we're talking now about how you develop your chronic pain problem. You've got these feelings running through of autonomic nervous system stimulation and the signals coming up and running through your spinal cord. Over time, your brain starts to devote more centers to pain experience because it becomes more interested in it. And one of the things that we know with people with chronic pain is that if you take them and you put them into an MR scanner and you look at brain function rather than brain structure, so you take lots of pictures over time and see where all the blood's flowing, we know that people with fibromyalgia have more centers in their brain devoted to pain experience and pain evaluation than people that don't. And if you compare it, and this is often something I say in clinic, if you look at an fMRI study from someone who doesn't have a chronic pain problem, it looks like a Welsh valley at night, a couple of little cottages twinkling in the valley. But at someone with fibromyalgia, it looks like a city picture, lots of lights firing up because the brain's much more activated regarding pain. So even in a chronic pain situation, and especially in acute pain situation, you can filter out signals. And that tends to happen in chronic pain and also in acute pain when there is a very, very threatening event going on or something that really distracts you. So, for example, in an acute pain situation, if you're worried about your life, you may not experience the pain until you've got through that moment of stress. And I think one of the best descriptions I've seen of that in the media is that scene in Saving Private Ryan, where the guys are storming Juno Beach in D-Day. There's this one soldier they focus on who runs up the beach and unfortunately gets his arm blown off. Now, obviously, that's a really uncomfortable and a painful experience. But in that scene, he doesn't stop. He picks his arm up and he runs up the beachhead with it, almost like a club. And he collapses at the medical center at the top of the beach, having got there. And you can see in that he's blocked all those signals out. And you can block the signals either through your brain pressing down and inhibiting signals coming through, or the signals being blocked out as they come into the spinal cord. And we'll talk a bit more about that in a minute. So in day-to-day, most of us don't storm up Juno Beach, but many of us have played hockey or they played rugby, and they've received a knock in hockey or rugby, which you've only really experienced afterwards when you're having a shower or when you're getting changed and your knee starts hurting or your shin starts hurting. It's the same thing. You've blocked those signals. So the brain can block signals depending upon how it evaluates the information to be important.